There are 32,000 nursing facility and assisted living residents living in Louisiana. There's going to be a silver tsunami. Our elderly population is going to grow by 40% within the next 16 years. Skilled nursing facilities are funded by several programs, one being Medicaid, another one Medicare. Also, VA will fund some of the residents in nursing facilities, and then of course long-term care insurance and private pay. Approximately 73% of our residents are eligible for Medicaid, so that's the vast majority of the residents who live in nursing facilities in Louisiana. We have in Louisiana, unfortunately, because of our budget issues, something that I call yo-yo budgeting. One year the legislature finds sufficient funds to budget us in accordance with our rate reimbursement. Other years we have to get a cut because there's not sufficient funds. This hurts long-term care providers because they really don't know how to budget from one year to the next with regard to the number of employees they could pay for, the amount of supplies they could buy, and other costs that would typically be utilized by a nursing facility. We serve a very vulnerable population. We don't have folks any longer who are capable of walking long distances. They need 24-hour nursing care. They're not like folks who could function in a home and community-based service setting where they might need a little bit of help with personal care services. Our residents need around-the-clock nursing services. They're much sicker, and I would submit they're much more vulnerable than folks who are in home and community-based services. And therefore, it's my opinion that the legislature should adequately fund nursing facility services. These amendments are very important to the general public, especially since we're going to have such a high growth of elderly in the next 16 years. Constitutional Amendment 1 will set up a stable funding source for nursing facilities, intermediate care facilities for the developmentally disabled, and for community pharmacies. It will also provide that the legislature should give serious deliberation to these programs before they do make a cut to the programs. And lastly, if we are cut, then the cuts would have to be fair across the board. The amendment is needed to ensure that we get away from this yo-yo budgeting and have a stable funding source. It would provide that any provider fees that are paid by a program would receive the benefits of the federal matching dollars that come back to the state. This is something that's done in a majority of the states right now that have provider assessments. So we think it's fair to those. Not only does it benefit the 3 programs that are in it now, but there are 19 other programs that could participate in provider assessments if they so chose. They could go to the legislature and ask that they pay a provider assessment. Then they would be entitled to the federal matching funds that would come back to the state. Amendment number 2 is the Hospital Stabilization Fund. It is also a provider assessment. It would be a new assessment on hospitals. There would be no new taxes for either of these amendments, and it would really allow about $400 million more. This would be new money coming into the state of Louisiana. So what it does is it really frees up additional state dollars that could be spent on all Medicaid programs, just not on these. As an example, right now, the Medicaid nursing facility budget has only 5% of state general funds assigned to it. That is much lower than most Medicaid programs. Most Medicaid programs have 37% of their funding assigned to state general fund dollars. So one of the things that we're looking for is that we bring in additional federal dollars so that the state general funds could go across the board and spread much farther than they are right now. My dad was in a nursing facility for 2.5 years, and I've got to tell you that without that facility, I believe his life expectancy would have been much shorter. They provided the care that he needed in his remaining years, and he received top-notch quality care, and I believe that that's what our nursing facilities provide in Louisiana. Because 73% of our residents are Medicaid eligible, this is vitally important to not only to them but to their caregivers so that we can have stable funding and get away from this yo-yo budgeting, as I call it. We have so many people who are now living in what's called a sandwich generation. They might have teenagers at home and elderly parents who are needing more and more health care. Those are the folks who have the most stress placed upon them, because not only do they have to worry about raising their children, but they have to worry about the health care needs of their parents. So many folks get to a point where they can no longer do this at home and have to place a loved one in either a skilled nursing facility or an assisted living facility. We want them to know that they are placing their loved ones in good hands, that we offer tender, loving care on a 24-hour basis, 7 days a week, and we'll take good care of them. We have a large coalition of groups who support 1 and 2, not only us, but the Louisiana Hospital Association, CARSA, the Community Pharmacy Association, and many others who are in the healthcare business or affiliates of healthcare businesses, vendors, people of that nature. So we have a large coalition of folks who are supporting this amendment. We're very pleased that our constitutional amendments are 1 and 2, because we know that many of the voters really key in on the first number of amendments. So we would ask them to pay special attention to at least these first 2 and vote yes. It's vitally important to our seniors and to even children and patients in general. This will mean an influx of additional federal dollars that can help pay for the services that they so vitally need.
If people have questions like more information, what should they do?
They can either go to our website, www.lnha.org, or they can call our office, 225-927-5642, and we have staff here who will be happy to answer their questions.